What if I told you that one of the most important protections against falling is not in your cane, not in your shoes, and not even in your legs alone, but in a tiny reflex most people never think about until it starts to disappear? And once that reflex weakens, something as ordinary as turning around in the kitchen, stepping off a curb, or reaching for a cup on the counter can suddenly become dangerous. Not because you are weak, not because you are careless, but because your body is no longer reacting fast enough in the split second that matters most. And that split second is everything. A fall does not usually happen because a person slowly loses balance over 30 seconds. It happens in a moment. Your foot lands awkwardly, your body shifts a little too far, you trip on a rug, misjudge a step, or turn too quickly, and in that instant, your body either catches you or it doesn't. That is why this matters so much. The good news is that this reflex can be trained. In fact, with the right exercises, many older adults can begin rebuilding better balance, better foot control, and more confidence in less than 2 minutes at a time throughout the day. Not an hour at the gym, not complicated equipment, not some exhausting routine you'll never stick with, just simple, practical movements that teach your body how to respond when life throws you off center. And today, I am going to walk you through 6 of the most effective balance exercises for fall prevention, especially for adults over 70. I will show you why they work, how to do them safely at home, and how to build them into your day without feeling overwhelmed. So, if fear of falling has been quietly affecting the way you move, if you've noticed yourself grabbing furniture more often, hesitating before stairs, or thinking twice before walking outside, this video is for you. And before we begin, if you enjoy practical health advice explained in a clear and simple way, subscribe to the channel and turn on notifications so you never miss a future video. Now let's start with a question. When most people decide they want to improve balance, what do they usually do? They stand on one leg. Maybe they hold onto the counter. Maybe they wobble for a few seconds, tighten their shoulders, stare at the floor, and call that balance training. But here's the problem. Standing still on one leg is not the same thing as training your body to prevent a real fall, because real falls almost never happen when you are standing perfectly still. They happen while moving. They happen while turning. They happen while reaching. They happen while shifting weight from one foot to the other. They happen when your body has to recognize, react, and correct itself quickly. That means the goal is not simply to balance in a frozen position. The goal is to train your body to recover balance. That is the difference, and the exercises in this video are designed around that exact idea. They teach your feet, ankles, legs, hips, and nervous system to work together again so that when your body starts to drift out of position, it knows how to bring you back. Before we go any further, though, I want to be very clear about safety. If you feel pain in your feet, ankles, knees, hips, or back during any of these exercises, stop right away. If you have had a recent fall, a serious injury, severe osteoporosis, Parkinson's disease, a neurological condition, or a diagnosed balance disorder, please talk with your doctor or physical therapist before trying a new balance routine. And no matter how strong or independent you are, always keep a wall, sturdy chair, or countertop nearby while you practice. That is not a sign of weakness, that is smart training. Also, please do not do these exercises in socks on a smooth floor. Socks on hardwood, tile, or laminate are one of the easiest ways to slip. Barefoot is often best for balance practice because it gives your brain more feedback from the ground. If barefoot is not comfortable or safe for you, wear supportive shoes with a non-slip sole. Now let me explain the reflex I mentioned at the beginning, because once you understand this, balance training starts to make a lot more sense. One of the most overlooked parts of fall prevention lives down in your feet, especially in your toes and the small muscles underneath your foot. When you begin to tip forward, lean sideways, or lose your footing, those muscles are supposed to turn on automatically. Your toes press into the ground, your foot stiffens just enough to create stability, your ankle adjusts, your brain senses the shift, and your body makes a fast correction before you ever hit the floor. That is one of the body's natural balance recovery systems. But over time, that system often becomes less reliable. Why? because many people spend years walking on flat, predictable surfaces, wearing thick cushioned shoes, sitting more, moving less, and rarely challenging the smaller muscles of the feet and ankles. As a result, those muscles get weaker. The nerves become less responsive. The connection between the ground and the brain becomes duller. It is not that your body forgot how to balance, it is that the signal got quieter. And if the signal gets too quiet, the response comes too late. That is when a tiny stumble becomes a major fall. But here is the encouraging part. You can wake that system back up. You can strengthen those small muscles again. You can improve the way your body senses the ground. And you can do it with simple, consistent practice. That is what these 6 exercises are really about. They are not about looking athletic. They are not about forcing yourself into difficult positions. They are about rebuilding communication between your feet, your legs, your core, and your brain. So let's get into the exercises. Exercise 1, the toe lean. If I had to choose just one movement from this entire routine, this would be it. The toe lean is the foundation. This exercise directly trains the forward balance recovery reflex that often weakens with age. Here is how to do it safely. Stand in what I like to call a safety corner. Go to the corner of a room where 2 walls meet and face into that corner. The walls should be in front of you, one on each side, so if you lean too far, you have immediate support. If it makes you feel safer, place a sturdy chair in front of you within arm's reach as well. Stand with your feet a few inches apart. Keep your posture tall, shoulders relaxed, chin level, back straight. Now gently lean your whole body forward from the ankles. Think of your body like a straight board tipping forward. Do not bend at the waist. Do not poke your hips backward. Just allow a small, controlled forward lean. As you lean, notice what happens in your feet. You should begin to feel pressure move toward the front of your foot and into your toes. Those toes should lightly engage with the floor. Before you reach the point where you need to take a step, use that pressure through your toes and the front of your feet to bring yourself back upright. That is 1 repetition. Start with 10 repetitions. Move slowly. This is not a race. The quality of the movement matters much more than the size of the lean. What you are practicing here is the moment right before a forward fall. You are teaching your body to recognize the shift sooner and respond more effectively. If you are barefoot, you may notice this sensation more clearly, which is one reason barefoot practice can be so helpful when done safely. Try doing this exercise 3 or 4 times throughout the day rather than all at once. A short set in the morning, another before lunch, another in the afternoon, and one in the evening can be more effective than one long session. Once it begins to feel easy, you can make it slightly more challenging by holding a light object against your chest, such as a small hand weight or even a can of food. That increases the demand on your feet and toes without making the exercise complicated. Exercise 2, side-to-side weight shifts. Not every fall happens forward. A lot of falls happen when someone reaches sideways, turns too quickly, or shifts weight unevenly while stepping. That is why lateral control matters so much. For this one, stand behind a sturdy chair and place both hands lightly on the back of it. Your hands are there for confidence, not for carrying your body weight. Stand with your feet about hip width apart. Now slowly shift your weight onto your right foot. As your body moves over that leg, allow your left foot to get light, and if you can, lift it just an inch off the ground. Hold for about 3 seconds, then slowly return to center. Now shift your weight to the left foot, letting the right foot become light or lift slightly. Hold again for 3 seconds, then come back to the center. That is 1 full repetition. Aim for 10 repetitions on each side. Go slowly enough that you feel the transfer of weight. You are not just moving side to side. You are training control. You are teaching your hips, ankles, and trunk to cooperate so that side movements feel steadier and safer. As you improve, reduce the amount of support from your hands. You might start with both hands on the chair, then one hand, then one fingertip, and eventually no hands at all. That gradual progression matters because confidence is part of balance too. If an exercise feels terrifying, your body becomes tense. And tension often makes balance worse. So let the support be there while you build trust in your own movement again. Exercise 3, heel to toe walk. This one is excellent for dynamic balance, which simply means balance while moving. Think about walking through a narrow hallway, stepping around clutter, or changing direction in a small space. Those are the situations that challenge balance in everyday life, and that is exactly what this exercise helps prepare you for. Find a hallway or a clear area beside a wall. If you need support, keep one hand near the wall. Place one foot directly in front of the other so that the heel of your front foot touches or nearly touches the toes of your back foot. Then take the next step the same way, heel to toe, heel to toe. Walk 10 slow steps in a straight line, then turn around carefully and walk back. That is one set. Start with 2 sets. The most important part is not speed, it is controlled. Try to keep your eyes looking forward rather than constantly staring at your feet. In real life, you are rarely able to watch every step you take, so you want your balance system to improve without depending entirely on your eyes. If that feels too hard at first, that is completely normal. You can widen the gap between your feet a little. Over time, gradually make the steps narrower as your control improves. This exercise challenges your balance in a very honest way. It exposes instability, but that is also why it works. Done consistently and safely, it helps build a steadier walking pattern and better coordination from one step to the next. Exercise 4, standing marches. A surprising number of falls happen because the foot does not clear the ground. A rug edge, a doorstep, a crack in the sidewalk, the base of a walker, even a pet toy left on the floor can be enough to catch the toe and cause a stumble. Standing marches help train the muscles that lift the leg and improve your ability to clear obstacles safely. Stand behind your chair again with light support from your hands. Lift your right knee upward as high as you comfortably can without leaning backward. Keep your chest tall. Pause for 2 seconds at the top, then lower your foot slowly back to the floor. Now do the same on the left side. That is 1 repetition. Aim for 10 repetitions on each leg. The slower you go, the more useful this becomes. Most people want to rush the lifting part, but the lowering part is just as important. Lowering the leg with control helps train the stability you need when your foot returns to the ground. That control can make a big difference when recovering from a trip. As this gets easier, try doing the exercise with lighter hand support. Then eventually, without holding the chair, keeping your arms out to the sides if needed. And remember, the goal is not how high the knee goes. The goal is a smooth, controlled lift and lower without wobbling or throwing your body backward. Exercise 5, clock reaches. This is one of my favorite balance drills because it trains something we use constantly in daily life, but rarely practice on purpose, reaching in different directions while staying stable on one leg. Everyday life is full of these moments, reaching into a cabinet, turning to answer the phone, stepping sideways around furniture, learning to grab a towel, a bag, or a grandchild's toy. The clock prepares you for that. Stand behind a sturdy chair, rest your right hand lightly on the back. Imagine you are standing in the middle of a clock face. If your left leg is moving, reach it forward toward 12 o'clock and tap the floor lightly with your toes. Return to center. Then reach out to the side toward 9 o'clock, return, then reach slightly behind you toward 7 o'clock. Return. That is 1 round. Do 3 rounds with the left leg, then switch hands and repeat with the right leg reaching toward 12 o'clock, 3 o'clock, and 5 o'clock. Keep a soft bend in the standing knee. Stay tall through your spine. Move slowly enough that the standing leg has to work. This exercise builds ankle control, hip stability, and balance in multiple directions all at once. And because life does not happen in straight lines, this kind of training is incredibly practical. If the full reach feels too difficult at first, make the tap smaller. A shorter reach is still useful. Over time, increase the distance only as much as you can control. Exercise 6. Sit to stand without using your hands. This one may not look like a balance exercise at first, but it is one of the most practical fall prevention movements you can do. Why? Because getting up from a chair is one of the most common and risky moments of the day for many older adults. Think about how often you stand up from the couch, the bed, the dining chair, or the toilet. If that movement feels weak, shaky, or rushed, your fall risk goes up. Sit to stand practice improves leg strength, trunk control, and transitional balance all at the same time. Sit near the front edge of a sturdy chair with your feet flat on the floor and about hip width apart. Cross your arms over your chest if you are able. If that is too difficult, place your hands lightly on your thighs at first. Now lean forward slightly from the hips so that your nose comes over your toes. Then press through your feet and stand up slowly. Once fully upright, pause for 2 seconds. Then lower yourself back down just as slowly, with control, until you are seated again. That is 1 repetition. Start with 8 repetitions. If you need some assistance from your hands in the beginning, that is fine. The goal is not perfection on day one. The goal is progress. Over time, use your hands less and let your legs do more of the work. This exercise strengthens the very muscles that help you get up safely, stabilize once you are standing, and lower yourself without collapsing backward. And those abilities are directly tied to independence. Now that you know the 6 exercises, let's talk about the smartest way to use them. One mistake people make is thinking they need to set aside a long block of time and do everything in one workout. You do not. In fact, for many older adults, a better approach is what I like to call balanced snacks. Short bursts of training, 30 to 60 seconds at a time, spread throughout the day. Do the toe lean while the coffee brews. Do weight shifts during a commercial break. Practice sit to stands before lunch. Try standing marches while waiting for the microwave. Walk heel to toe down the hallway once in the morning and once in the evening. These small moments add up, and they fit into real life much better than an intimidating routine that feels like a chore. Consistency matters more than intensity here. Your nervous system learns through repetition. Your feet and ankles get stronger through repetition. Your confidence grows through repetition. That is why a little done often can be far more effective than a lot done once in a while. I also do not want you trying to master all 6 exercises in one day and then quitting because it feels like too much. Start smaller. For the first several days, practice only the toe lean and the side to side weight shift. When those begin to feel more natural and less shaky, add heel to toe walking. Then add standing marches. Then the clock reaches. Then sit to stands. You can add one new exercise every few days or every week, depending on what feels manageable for your body. There is no prize for rushing this. The goal is to build a routine you can actually keep doing, because that is where the real change happens. And on that note, I want to say something important. Do not skip these exercises on the days you feel good. Those are often the days people think, I'm steady today, I probably don't need it. But feeling good is not the reason to stop. Feeling good is often the result of the practice. Every repetition is a reminder to your body. Every time you shift weight with control, every time your toes grip the floor, every time you stand up smoothly from a chair, you are reinforcing a pattern. You are teaching your body what to do automatically when you stumble unexpectedly. And that is the whole point. You are not practicing for the exercise itself. You are practicing for real life. For the moment you catch your foot on the edge of the rug. For the moment you turn too quickly when someone calls your name. For the moment you step onto uneven ground and your body needs to recover before your mind even has time to think. That is what balance training is really for. It is not just about preventing injury. It is about protecting confidence. It is about staying independent longer. It is about moving through your home without fear. It is about walking outside, shopping, cooking, visiting family, getting the mail, and living your life with more freedom and less hesitation. And while balance is a huge part of fall prevention, it is only half of the equation. The other half is leg strength. Because even if your body senses a loss of balance, it still needs the strength to do something about it. It needs the legs to push, the hips stabilize, the knees to support, the feet to react. If those muscles are weak, recovery becomes harder. Getting up becomes harder. Walking becomes slower. Trips become more dangerous. That is why balance work and leg strengthening belong together. The encouraging news is that the body can still adapt, even later in life. Muscles can still respond to training, coordination can still improve, confidence can still come back. It may not happen overnight, but it absolutely can happen. And it starts with doing the simple things consistently enough for your body to trust them. So here's a practical way to begin. This week, choose just 2 exercises: the toe lean and side to side weight shifts. Do them once in the morning and once later in the day. Keep a chair or wall nearby. Move slowly. Focus on control, not effort. Next week, add heel to toe walking. After that, add standing marches. Then the clock reaches. Then the sit to stands. By the end of several weeks, you can have a complete home balance routine that takes less than 10 minutes total, yet supports one of the most important goals of healthy aging: staying on your feet, staying capable, and staying independent. And let me leave you with this: a lot of people think falls happen because of bad luck. Sometimes luck plays a role, yes, but very often what looks like bad luck is really an untrained body meeting an unexpected moment. The wonderful thing is that unexpected moments can be prepared for, not perfectly, but meaningfully. And every time you practice these movements, you are giving your body a better chance to respond well when it matters most. That is powerful, that is hopeful, and that is worth a few minutes a day. If this video helped you, let me know in the comments by typing number 1. If there is a balance problem or walking challenge you would like me to cover in a future video, tell me that too. I read the comments, and they help shape what I make next. And if you know someone who is afraid of falling or who has become less steady lately, share this video with them. It may give them exactly the confidence and practical guidance they need. Also, don't forget to subscribe and turn on notifications so you don't miss the next video. Because in the next one, we are going to cover the other half of the equation: the best leg strengthening exercises for adults over 70 that can be done safely at home without gym equipment. Those exercises pair perfectly with today's balance routine and can help you feel stronger, steadier, and more secure with every step. Thank you so much for watching. Take your time, move safely, stay consistent, and here's to protecting your independence, one steady step at a time, up at a